Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hi everyone. So with my recent visits to both the ER and the doctor's office, I've been thinking a lot about the deep-rooted problem of healthcare. So as I communicate daily with you on mainly Facebook, I recognize that there's a big gap between health and disease. So I thought I would clarify the functional medicine model today to help you to shift your view from thinking disease management to actually creating health. So let's talk a little bit about the current healthcare model. So we have an epidemic of patients getting sicker and sicker. And just this past year, the International Statistical Classification of Diseases and Related Health Problems, referred to as the ICD-9 codes, were updated to ICD-10. This is a coding system to name the disease to universally make it easier to diagnose, treat, and to bill for us providers. ICD-9 versus ICD-10 went from 12,000 diseases to 155,000 diseases. It's a crazy time as healthcare spending is out of control when most of the diseases can be reversed or prevented by lifestyle intervention. It's a worldwide issue as there will be a shortage of doctors as the number of people who are getting sick are increasing. 20 years ago, the obesity rate across the United States was under 20% across all the states. Today, the obesity rate is over 25% across all the states. It used to be that back when I graduated from graduate school in 2001, the incidence of childhood diabetes was 1 in 10. Today, it's 1 in 3. I'm seeing more younger women in their teens for PCOS, IBS, adhesions, and various autoimmune conditions like lupus and Hashimoto's. As we become a global world and processed foods are being introduced into China and even India, the incidence of diabetes in these two mega countries are exploding. So let's talk a little bit about disease versus symptoms. Disease is nothing more than a list of symptoms. Yet, when we complain of symptoms, our medical system is quick to name it, then to try to tame it and blame it, right? There's a functional flaw in the way we treat disease. We're busy treating the symptoms rather than the cause. For example, a symptom of diabetes is high blood sugar, and the medical community blames the diabetes and provides the medication for the symptom without asking what the underlying cause of diabetes or uncontrolled blood sugar levels could be. So doctors are quick to place patients on diabetic medications or insulin to manage the blood sugar levels. But did you know that those with the most intensive therapy to drive their blood sugar down had the most deaths and heart attacks? We should be asking, why is it elevated? Work on the diet and the nutrition intakes first, the variables that are obvious and common sense. So insulin, usually used for diabetes, increases inflammation, triglycerides, it increases the oxidative stress, and it increases your appetite, which leads to obesity and lowered HDL, which are good cholesterol, which are classic causes of heart disease. So a classic example, Avandia, a diabetic medication, caused side effects that resulted in 200,000 deaths since 1999 from heart attacks. In another study, 26,000 people were given statins to prevent heart disease, which resulted in 87% increase in type 2 diabetes. And according to the Women's Health Initiative, statins increase diabetes risk in women by 48%. So we should stop mopping up the water from the floor and rather think about turning off the faucet, right? So let's talk about balance as being key. We should aim to achieve homeostasis and health rather than looking to diagnose and manage the disease. I hope that in the future they include a nutritional curriculum in the medical schools. It's an absolute necessity as food is medicine. And at the end of the day, we all know that drugs don't fix the root problem, only its symptoms. Most often, with autoimmune or chronic diseases, we're looking at systemic dysfunction. So for example, all illnesses will result in mitochondrial dysfunction, which is your cell's ability to produce energy for your body. It's how we use fuel, right? But the medications interfere with the metabolic pathways that enables our mitochondria to function to produce energy. And when we end up with a mitochondrial dysfunction, we will be fatigued, have muscle weakness, foggy brains, and may end up with depression as well. So, talking about natural laws, it's time to respect natural order, Mother Nature. But in medicine, we tend to have a microscopic view of our human biology. For example, if your bones hurt, you go to the bone doctor. Your stomach hurts, the stomach doctor. You have nerve pain, go to the nerve doctor. Eye issues, you go to the eye doctor. Heart issues, you go to the heart doctor. But human biology is infinitely complex. We're a complex adaptive system which is constantly changing daily. So functional medicine is a model to filter through the information from you as the patient and think through the problems using the framework of the biomedical system as termed by Dr. Hyman with the Institute of Functional Medicine. So it's actually globally addressing you as opposed to the disease. So this is because clearly a disease manifests differently for every individual. So the important thing is to focus on the patient who has the disease rather than treating the disease. So functional medicine. Functional medicine looks at the bird's eye view of all your systems and how they're personalized to you. It's a shift from treating the organs to the organism, right? We have a tsunami of chronic diseases in the world today, and at the root, inflammation is responsible for our imbalances. We also understand now that genes play a huge role in symptoms manifestation. However, we also understand that genes are influenced by the environment, including the social, spiritual, our microbiome, and the nutrients. So Dr. Sidney Baker from the Institute of Functional Medicine eloquently described the tack rule. You stand on the one tack, and if you get rid of that one tack that you're standing on, you'll feel better, right? But if you're standing on two tacks and take one out, it doesn't make you feel 50% better because you'll still feel the pain from that other tack. There's lots of different elements to multi-system involvement, so there's so much more to the symptoms than meets the eye. Masking it with the medications causes unnecessary side effects, which are often worse than the initial symptoms. So we need to be careful in how we disrupt our very own ecosystem. So functional medicine aims to differentially diagnose and understand the nature of the symptoms and then to understand the underlying root cause. Diseases are only a way of explaining symptoms. Our bodies are like an ecological system that needs balance and adaptive processes. And if we all do is throw more toxins, or such as medications and toxins in foods, into our body, our ecosystem doesn't have a chance to survive. So we have to look at the big picture and address the whole system. So simply put, our approach is to remove what causes imbalance and provide what creates balance, because we know that it's all about balance. So food is medicine, because every one of us consumes thousands of pounds of food each year. It's helpful to look to food. There's no better medicine than food. However, we need to think about the quality of the foods. Rule of thumb is if God made it, then you can eat it, but if a factory made it, then it's a no-go. Our foods are so much more than calories. It's not all calories are created equal. Some man's medicine may be another man's poison, meaning that we have to be respectful of our individual differences. And that's where we can help to fine-tune what's optimal for you. So talking about managing disease versus healing disease. So we choose to look at the root cause and create balance by focusing on health. Using the example of a tree, you can clearly see the tree roots are where the health of the tree is most important. The leaves and the branches of the trees are only an extension and a reflection of the health of the roots. So it makes sense to focus on the root and creating balance first there to decrease the symptoms and improve function. For example, depression is a name for symptoms, not a Prozac deficiency, right? Similarly, high cholesterol is not a statin deficiency. We begin asking the hard questions and find where the root causes are to then calm the symptoms once and for all by creating health. In the case of depression, it can be a result of many different root causes. As I mentioned, it's not a Humira, Effexor, or a Prozac deficiency. It may be a B12 deficiency due to acid blocker use, or it can be due to gluten sensitivity that overtaxed your immune system and developed Hashimoto's, which resulted in low thyroid, which then caused you to have depression, for example. And because we all know now that gluten is a common offender, that can lead or exacerbate depression, leading to RA, IBS, cancer, dementia, or even lupus. You may think that not everyone will have gluten sensitivity, and you'd be correct. It's on your genes that dictate your susceptibility and certain antecedents, triggers, and perpetuating factors that are highly specific to you. It may be the vitamin D deficiency because you don't see the sun too much due to lupus or autoimmune, which can cause depression. Or it may be because you took antibiotics which changed your microbiome and caused you to have an imbalance, leading to depression. Or maybe because you have sushi or fish too much, you had mercury overdose over time, which resulted in depression from mercury toxicity. It may be because you love sugar, for example, and processed foods, which causes a nutritional imbalance, leading to a deficiency, right? Differences between integrative medicine is another thing. Between functional medicine and integrative medicine is another thing that I want to talk about. So integrative medicine is when you are using alternative therapies with conventional medicine. For example, you are open to using acupuncture, meditation coupled with medications, like incorporating mind, body, and spirit type of a paradigm, but still resorting to conventional medicine. Functional medicine, on the other hand, is a paradigm shift from the conventional medical system of looking at disease management to health management. Functional medicine uses a new map and tools to get away from pathology to function. It's not so much about the disease so much as it is about you. And rather than thinking silos of medicine, right, it's about interconnections, patterns, and understanding the causes of your symptoms in order to find the solutions using the laws of nature to create balance and ultimately create health. So functional medicine is really about understanding the underlying causes of disease, such as toxins, allergens, and microbes, nutrition, and your stress and its impact on your health, coupled with gene expression, genomics, your genes. Nutrigenomics is the foods coupled with your genes, and epigenetics, which is the environment and its impact on your genes. And considering the system imbalances like your gut, immune system, endocrine system, and your physical stature and physical health, as well as spiritual and psychological health. We always ask the question, have you done everything for this patient? Have I been thorough? Did I cover everything? And two main questions that we ask are, does this patient need to be rid of something, like toxins, allergens, infections, and poor diet and stress? And does this person have an additional need for optimal function, like enzymes, coenzymes, nutrients, vitamins and minerals? And depending on our genome, we have different needs, and it's not so black and white sometimes. In this way, we begin to remove, replenish, and balance so that we can create the health that you need. And primary causes of disease. Who do you need to get rid of? Like, it can be your relationships, What are some of the toxins, like biological, elemental, synthetics, that you're constantly around? What are some of the allergens, like food, mold, dust, animal products, pollens, and chemicals? What about the microbes in you? Bacteria, ticks, yeast, parasites, and your exposure history? What's your stress like, physically and psychologically? What kind of a diet are you on? Are you on a SAD diet, standard American diet, full of processed foods? What do you need to thrive? Something like foods. Do you need proteins, fats, and carbs and fiber? And how do we replenish that? Do you need vitamins, minerals, accessory or conditionally essential nutrients? And sometimes hormones too, right? Do you have enough light? Are you drinking water? Do you have good air? Are you moving? Are you exercising? Are you sleeping and resting? Do you have enough love and community and connection in your environment? And do you have meaning in your life and purpose? Functional medicine is not a test, treatment, or supplement. It's a new way of thinking and focusing on the patterns and inner connections, on finding the causes that lead to the clinical imbalances and learning how to create balance is what this is all about. So going on to the power of connection. We're creating a movement here with Lupus Rebel and in our clinic to use the power of community to change our current state of health or lack thereof. And it requires love, support, and connection. So please join our movement by signing up on our blog, subscribing to our YouTube channel, join our Facebook group, and like us on our Facebook page. For our podcast listeners, you can find our show notes on kanijian.com/podcast/. Please subscribe to our podcast and review would be extremely appreciated to help spread our message of health and hope. Thanks for joining us. We'll talk to you soon.
Thanks for listening to the Health Made Easy podcast. www.drconniejean.com